Hello everyone and welcome to today's foster parent training. My name is Vanessa. Today we will be going over many important topics related to the expectation of care you are responsible for providing to the children placed in your home. Here's an overview of the topics we will be discussing. We will be covering monthly receipts, allowances, medical forms, including the CFS 125, the LIC 602, the LIC 622A, the LIC 622B, and then we will follow it up with a team activity, filling out medication logs. The objective of today's training is to inform current and potential foster parents of the guidelines, requirements, and expectations associated with caring for foster children placed in their custody. I encourage you to take notes. If there's something you require clarification on or have a relevant question, please do not hesitate to ask. Now let's get started. Okay, let's discuss monthly receipts and allowance. We'll begin by discussing the monthly clothing allowance. As a foster parent, it is your responsibility to ensure that each month you are purchasing at least the minimum required clothing items for each child in your care. Each child is allotted $60 per month to be spent on new clothing items. While it is acceptable to purchase clothing items on sale and use coupons, it is not considered acceptable to purchase children's clothing from secondhand stores or yard sales. Please keep in mind that if you are using coupons to make your purchases, the amount spent will be calculated based on the total amount rather than the value of the items purchased. All purchases must be divided by child, meaning only the items purchased for one child should be on one receipt. It is acceptable to have multiple receipts in a single month for one child. In the event that you purchase more than the allotted $60 per child, the excess spent will be rolled over as a credit for the following month. Please keep in mind that if for any reason placement changes and the child is suddenly removed from your home, you will not be reimbursed for additional funds spent on that child. Please be sure to keep track of all of your receipts and purchases. At the end of each month, these clothing receipts will be submitted to the agency along with a form. I strongly recommend keeping copies of the receipts for your purchases in the event that any paperwork should go missing. You can either photocopy the receipt, request an additional copy at the store, or take a picture and keep a digital copy. Receipts will be due to the agency no later than the 5th of the following month. There is sometimes confusion about what is considered appropriate to purchase for children with that $60 allowance. Examples of acceptable purchases include diapers for infants. However, keep in mind that the diapers purchased must be a reasonable amount for the month. Purchasing diapers in bulk for 2 or 3 sizes ahead would not be considered appropriate. Socks, shoes, undergarments, t-shirts, pants, jeans, shorts, hats, beanies, and gloves each qualify as acceptable purchases. Each child in care is also required to have a bathrobe. Therefore, it would be considered appropriate to purchase a bathrobe if the child does not already have one. Once again, please ensure that the bathrobe is an appropriate material and capable of serving its purpose. In the past, we've had teenage girls attempt to justify the purchase of silk robes. These would not be considered appropriate and would not be covered by the clothing allowance. Items which are not considered acceptable and will not be calculated toward reaching the $60 minimum allowance include backpacks, costumes, sports or extracurricular uniforms, toiletries, and PE clothing. Please keep in mind that this does not mean that it is not your obligation to purchase these items. If a child requires a backpack for school, we still expect you to purchase that backpack for them. If Halloween is coming up and the child in your care celebrates, please ensure that they have a costume and are able to participate in festivities. As an agency, we work very diligently to provide a goodness of fit among children and caregivers. However, at times there are unavoidable clashes between religious or spiritual beliefs. While we do not expect you as a caregiver to alter your beliefs, we do request that you respect the beliefs of the children and allow them to participate in holidays and festivities to some extent. Please understand that many of these children have grown accustomed to inconsistencies. Major holidays may be one of the few definite things for them. Additionally, we want children to feel comfortable in your care, and allowing them to express their beliefs and celebrate them plays a role in that. Sports uniforms are also not calculated into monthly clothing allowances. Our agency strongly supports children's participation in extracurricular activities due to the many social, emotional, and cognitive benefits, but unfortunately, sports uniforms do not qualify toward the clothing allowance. Toiletry and other hygiene products are also not counted. These are considered essential and should be provided on behalf of the caregiver. This does not mean that the child has the ability to dictate the type of toiletries or hygiene products provided. Again, we ask that you treat these children as you treat your own. Therefore, shampoo, body wash, or deodorant which you feel is acceptable for your family members is acceptable for the additional children placed in your home. In the event that a child placed in your care requests a $40, $50, or $60 product, please know you are not obligated to purchase that item. If there is a specialty item that a child prefers, they are welcome to save up their allowance and purchase that item on their own. If you are willing to purchase it for the child, the agency strongly recommends that you have them earn it. This can be done through obtaining good grades or helping with chores around the resourced home. Lastly, the monthly clothing allowance cannot be used to purchase school-branded PE clothing. These are considered to be school materials. However, basketball shorts, sweats, and t-shirts are each acceptable items. In addition to clothing allowance, children aged 5 and up will receive a monthly monetary allowance. This allowance must be handed to the child and be allowed to be kept in their possession unless special circumstances exist. If special circumstances do exist, they need to be discussed and documented with an agency social worker. Allowances can be distributed either weekly or monthly. If the allowance is distributed on a weekly basis, please note that you are not required to give an additional allowance if a fifth week should occur in a month. Allowance is distributed based on the age of the child. Children between the ages of 5 and 11 years old receive a total monthly allowance of $20. Children between the ages of 12 to 14 receive a total monthly allowance of $40. And children 15 years of age or older receive a monthly allowance of $60. We have had issues in the past where children claim to not be receiving their allowance. After looking into some of the cases, we were told by foster parents that the children had requested items in place of the allowance, therefore did not receive cash. Please do not do this. Children must be receiving their allowance, either in the form of cash, loaded to a card, or in a digital form, such as through Zelle or Cash App. Please select a form of payment that you feel is appropriate for the child in your care. Here is an example of the form we require for both the clothing allowance and the monetary allowance. This is called the Monthly Receipts and Allowance and Activity Form. On this form, please provide your name, the child's name, their age, how many days they were in your care for the reporting period, as well as the month and the year. So if this form were being submitted for the month of May, the month would be May and the year would be 2024. All receipts attached to this form should be dated between May 1st and May 31st. The receipts and form would be due no later than June 5th. On this form, you can see a table for a quick reference to the ages and allowance amounts in case you forget. Beneath that, there are lines for 4 weeks out of the month. On each of these lines, you will fill out the amount of money provided to the child during the corresponding week. If you choose to pay the child once per month, please zero out any of the lines which do not apply. Beneath that, there is a section that asks which activities you have done with the child for the month in question. Please do not leave this area of the form blank. It is important to show that you're involving the child in activities outside of the home and in the community. Maybe you took the child to a park. Did you visit a store? Do they have extracurricular activities they participate in? Have you visited a library? Please make sure you are not only allowing the children these opportunities, but documenting them as well. Lastly, please do not forget to sign this form. If the child in question is over 5 years old, they are required to sign this form as well. Now moving on to medical forms. Each time a new child is placed in care, they are required to undergo a physical and dental exam. These exams are required to take place within the first 30 days in care. This is extremely important and assists the child in receiving care, and it also protects you as the foster parent. If a child is placed in care and suffering from tooth decay, we want to identify that immediately rather than have accusations of a lack of care fall on you as a foster parent. Additionally, we want to ensure that all needs are identified and attended to in a timely manner for the child's health and safety. The same goes for medical appointments. Children who are admitted underweight or are suffering from vitamin deficiencies need to be identified as soon as possible. Historically, biological parents have attempted to point the finger at resource parents, claiming that their children were not being fed and were malnourished as a result. Attending medical appointments in a timely manner can assist in combating these accusations. Children who were previously in placement and have attended medical and dental appointments within the necessary timeframes do not require appointments within the first 30 days of placements. However, if you suspect a visit to the doctor or dentist is necessary, it is completely acceptable to arrange an appointment. Children under the age of 1 are also exempt from the required dental exams because they're too young. Each time a child is seen at a medical or dental office, a medical form CSF 125 is required to be submitted to the agency. I also recommend keeping a copy of each of these filled out forms for your records. This form should be completed by office staff or an attending physician. However, you are free to fill out the portion that lists the child's name as well as the location or date of visit. Please do your best to always keep extra blank copies of this form on hand, as you never know when the child may require an urgent care or an emergency room visit. The next form you should familiarize yourself with is the medical form LLC 602. This form consists of 4 pages. It is required only for initial medical visits. Before leaving the medical office with this form, please ensure that it is signed by the physician and dated. This form is extremely important, as it lists existing medical conditions and prescriptions. There's also a portion in this packet where the physician authorizes which over-the-counter medications are acceptable for children experiencing various discomforts, such as headaches, constipation, diarrhea, indigestion, allergies, etc. Without this form filled out or an alternate 125 listing a prescription, you are not allowed to administer any medication to the child in your care, including fever reducers. This is both for the safety of the child and protection of you as the caregiver. In the unlikely event that a child is to experience an allergic reaction, we want to make sure that there is documentation on file stating that a medical professional authorized use of the medication. Anytime a medication is administered to a child, whether over the counter or prescription, a medication administration record needs to be filled out. There are 2 types. The type of medication administered will determine which medication log you'll use. If the child has been prescribed psychotropic medications, such as antidepressants, anti-anxieties, antipsychotics, or stimulants, an LIC 622B will be filled out. For all other prescription medications or over-the-counter medications, a 622A will be filled out. If a child is taking an over-the-counter medication or a non-psychotropic medication in conjunction with a psychotropic medication, you will need to fill out one of each of the forms. To gain a familiarity and comfort with filling out these forms, I invite you to pair up and complete the provided logs utilizing information from this slide. Feel free to use either participant as the resource or foster parent. These are example prescriptions, but for the sake of this activity, we are going to assume both prescriptions are for the client Jane Smith. I'll give you a few minutes to complete these in your pairs, then we will review them as a class. Thank you for completing that activity. As most of you have identified, to properly fill out the medication logs, we would require the use of one Form 622A for the amoxicillin and one Form 622B for the Zoloft. That concludes the first portion of our training. If you have any questions, please do not hesitate to ask. Thank you, and I hope you have a wonderful rest of your day.